coronavirus has brought severe health risks to our country, we need to look at another approach other than simply shutting down our economy should a second wave hit. I think one of the things that's concerning to me is as the data continues to roll in, we are trying to take sides in this situation where one group looks at only the coronavirus and we have another group that's looking at the other side of the balance sheet here of the health and welfare of our citizens and our economy. This past week, there was an article in the Hill, for instance, 3 different engineers, scientists, health professionals came up with some of the latest data on our economy and how it's being affected. It said here the average estimate of the loss of a life over the next several months due to the economic shutdown is we're looking at 65,000 lives per month based on suicides, overdoses, all those other sorts of things. Here's some other statistics. 650,000 cancer patients receiving chemotherapy, estimated half of them missed their treatments. 150,000 new cancer cases that are typically diagnosed aren't being diagnosed. By probably as much as 2/3 to 3/4. Over half the childhood vaccinations are not being performed. This is going to be a tragedy that we have never, that's beyond description here if we don't start thinking on the other side of this balance sheet. But I want to keep people's minds here that just don't look at this as a ball game where you look at so many deaths on this side of the sheet and so many deaths on that. We're talking about people's lives. We should be looking at all the lives. And reopening is important to get this other side of the balance sheet to where we can keep people from being harmed on that side. I know, Mayor Curry, you have been aggressive in getting your state and your city in particular open. I know you mentioned a while ago you've increased in drug overdose as a result of the shutdown. Do you think your city can survive a second shutdown so that should another coronavirus second wave pop up here?
Well, anytime you're making decisions, thank you for the question, Representative. Anytime you're making decisions, you say never because you never know what will come. But I will say this, and I've said before, I do not believe another shutdown is sustainable. I do not believe it's an option. The virus is with us. We now know that it affects those with compromised immune systems, the assisted living facilities. So we have to do business in a way that's responsible and make sure that we protect those that are most vulnerable.
Thank you. I know the CDC even action this past week said it's time to get everybody open and get going again, which I think is very important. A number of you mentioned this morning about data, how important data is, or data driven. Mr. Mayor Barnett, I know you represent all the mayors across the country here. You made a comment that it's locally executing reopening is how things should be done. But when you talk about data, I saw a piece of information this week with regards to vaccinations. It really concerned me. It said that over 50% of the people are not willing to either get a shot or would not want to take a shot. How are you going to reopen? What is your plan down the road to maintain being open if you can't vaccinate? Because a lot of folks say, well, we're not going to open until we get a vaccination. Well, what happens if we don't get a vaccine? We don't have a vaccine for HIV. We don't have a vaccine for Ebola. We don't have a vaccine even for SARS. What happens if we don't get a vaccine for the coronavirus? And 50% of the people, even if we do get one, don't want to take the shot. How do you address that situation with your city?
It's a great question. Thank you, Congressman. I appreciate it. I think this is where I tend to be optimistic about the way Americans, red and blue, and particularly the way mayors have led. I think we are using this opportunity. I'm from a state where our governor has chosen a very strict shutdown process. But within that, what we're trying to do in our city is understand how we can operate, how we can reimagine, how we can innovate. And I think we're going to have to do that. I agree with you. A second shutdown would be catastrophic in our community and across this country. So what have we learned through this first shutdown that would allow us to deal with some of the things you're talking about? A quick example here, I think we've learned how to operate. If we were to have some sort of restrictions on us, we've learned to do all the kinds of inspections virtually, where we don't have to do them in person anymore. As it relates to vaccinations, every industry, every mayor, every city can have to look and reimagine how they operate. You're exactly right about the need for us to imagine this differently. And in order order for our country to regain the confidence, we're going to have to tackle some of these really tough questions.
I just have one comment. I know my time is up here, but I know that Mayor Benjamin made the comment a minute ago about the municipal bond market and support that the Treasury and Fed put out there so that they would be able to shore up the municipal bond market and keep it adequate for the bond market not to collapse. And I think I appreciate that comment because I said in financial services, this was a big deal. We were working on this for quite a while. The Fed and Treasury put together a program to prop up the market to make sure that the bond market didn't collapse, and I appreciate that comment. And with that, Mr. Chairman, I yield back. Thank you very much.
Thank you for yielding back the time. The chair now recognizes Mr. Foster. Well, thank you to all of our mayors here. You serve at the level of government that I think is probably provides the most personal satisfaction, because you get to make decisions and see those decisions reflected as you drive by the people that you represent every day. So, and I also want to second the advocacy of Mayor Benjamin for extending the direct support for municipal bonds by the Federal Reserve to cities with populations below 250,000. I have in my district the second, third, and fourth largest cities in Illinois, Aurora, Joliet, and Naperville, but none of them qualify for direct muni bond support from the Fed. And we're working as hard as we can to change this, both at the state level and the federal level. Now, public health experts have warned that the American people must prepare for a second wave of coronavirus later this year. Dr. Robert Redfield, the director of the CDC, has warned, quote, there's a possibility that the assault by the virus on our nation next winter will actually be even more difficult than the one that we just went through. And there's a lot of historic precedent for this. Mayor Garcetti, you have been warning about the possible resurgence of the virus since March, and you called the current lockdown, quote, the first battle of the fight. So as cities all over the country take steps to reopen their economy, what are the key elements that are necessary to have in place to limit the spread of virus and respond quickly to a possible second wave? And secondly, how do you explain to people who are bone weary of being closed and locked down that unless they take hygiene and social distancing seriously, that they're very likely to be right back where we started within a few weeks?
Great questions, Congressman. Thank you. It's exactly living in the gray that we've done. These myths of places that are completely closed or completely open. Everybody is living in this gray until we have a cure in every country in the world, in every city in America. There are key things, though. We're not moving beyond COVID-19. We're learning to live with it. We're learning to be smarter and better. For instance, in Los Angeles, with much criticism, I kept our construction trades open the entire time. We brought inspectors in to make sure that there was safe PPE for our workers, and men and women who are our carpenters and our electricians and others. We made sure there were folks on site that were educated and encouraged about that. And it really wasn't about enforcement. These myths and these kind of caricatures, we were able to not see any outbreaks in our construction trades. And that became the model for what we're doing successively in other places where we're opening up. So, you have to follow your hospital beds. You've got to stand up testing in particular. I'm very proud because we have no money. We have to take this out of our own budget. Even our county didn't give us money. And I said I would test anybody in a 10 million county area, even though I'm responsible for 4 million, because that's what the medical experts said was important to do. So we stood up testing. We say that asymptomatic testing to find the silent spreaders. And then we're putting a real focus, as I said, we've gone into every single skilled nursing home. And I just want to say briefly, this is a virus that thrives off of division. When people die when we are divided. And I came here to praise and unite and not to insult and to divide, to show it's working and not to score political points. So I appreciate that. I hope that we can all show respect and be respected and appeal to our better angels and not become a bunch of pit of wrestling demons. I know that you serve on this committee because you want to hear what works, but testing and giving that assistance to the state and local level is absolutely critical for all of us who uphold our Constitution. As elected officials, we take that oath. As a veteran, I've taken that oath. I'm proud to do that alongside my mayors and each one of you.
Thank you. And, we have a little bit of talk here, which I think is important, about the trade-off between spending money and saving human lives. It's a decision we make in Congress every day, every time we take a vote. There's an element of that, and it can't be the only consideration because of how precious human lives are, but it has to be a factor. And I just want to point out that the cost of wearing a mask is near zero. And so I just want to have any mayor who wants to pipe up on this. But what do you actually say to someone when you see people saying, great, the businesses are now open, so I don't need to wear a mask, even when they're walking right close to people and not obeying social distancing? How do you handle that problem? Any mayor that wants to jump in.
I'd be happy to do so. Mayor Barnett was kind enough to appoint me as the chairman of Mayors for Mass, the United States Conference of Mayors, Congressman Foster. It is a simple action that we can all do to not only protect our own personal health. God gives us one temple that we have to take care of and preserve for hopefully for a long time to be with the people that we love. And then the role of mutual responsibility, just making sure that we are our brother's keeper, our sister's keeper. It's simple, just as you said, it costs nothing. It is a simple accommodation that allows us to make sure that we're able to corral the spread of this virus, back it up with the testing, tracing, and supported isolation that the chairman mentioned earlier. Is so important. I would be remiss if I didn't say quickly, the work that you've done thus far, again, we're thankful for it. We've had a number of different conversations here that have nothing to do with the topic that we're discussing today. And I want to again encourage Congress to move with the same amount of gravity and speed to address the real issues that we're talking about here. How, in fact, do we sustain the level of basic services to citizens that take care of us every single day? We're not talking about money flowing from DC like manna from heaven. We're talking about the repatriation of tax dollars back to the local level where we can take care of our citizens' needs. Mr. Chairman, I would be remiss if I didn't say before we left that we've seen some great challenges emerge, obviously illuminating some of the Achilles heels of American society right now. One that I know you're passionate about is the digital divide. The challenges that we're seeing as we talk about the next greatest thing. The challenges that we're seeing and the opportunities to make sure that we're connected with all of our citizens in urban and rural America alike, and the suburbs too. We saw in April a survey of South Carolina teachers, only 17% of them have been able to contact all of their students in our state alone. Our state superintendent of education indicates that between 31 and 39,000 students have not been in contact with their schools and schools shut down. We recognize that there's some major challenges that we can address as a country working together right now, and that while social distancing is important to corral the spread of this virus, that obviously that we also realize it's economically ruinous. These are not mutually exclusive. We can work together, and we also want to make sure it's clear that cities are not a special interest, that we're working for the same people. Let's see if we can do that together. Thank you so much.
Thank you, Mayor Benjamin, and thank you, Mr. Foster. The chair now recognizes Ms. Wellesley.
Thank you, Mr. Chairman. Thank all our witnesses who are here today as well. I want to start by thanking our hardworking mayors, all of our elected officials in my district that have worked together on task force, and our healthcare workers as well. I want to thank our governor, Governor Eric Holcomb, for making Indiana a leader on coronavirus response and transparency. The state's 5-phase reopening plan is a responsible way to restart our economy while still working to contain the spread and flatten the curve. Indiana also pioneered a first of its kind small business PPE workplace where eligible small businesses could apply for bundles of face masks, face shields, hand sanitizer free of charge. The marketplace has fulfilled more than 20,000 orders so far. Just want to give a shout out real quick to Mayor Durkin. Give us a shout out in the Hoosier State. We are in full production because of the Defense Production Act of domestically producing large supplies of PPE. I'll also note that Indiana is being open and transparent about how it's using federal funds. Governor Holcomb recently detailed to the Indiana delegation how the state used its $5 billion in federal funding on comprehensive testing, costs for emergency operation centers, PPE for critical workers and businesses, long-term care strike teams, congregate homes and child care providers, and a $300 million grant assistance program to our local communities. Coronavirus is unlike any in our lifetimes, and our country has experienced a devastating loss of life. Emergency actions like stay-at-home orders were necessary to slow the spread and flatten the curve, but we're also seeing a broader toll on Americans' health that we just can't ignore. such as adverse outcomes for women's health and individuals with substance abuse. We need to protect women's health by ensuring they can see their OBGYN, receive a mammogram, and give birth in a hospital without fear. In my district, the local domestic abuse crisis line saw a 50% jump in calls as well. We're seeing drug overdoses back on the rise. I commend the Trump administration for enabling telehealth treatment, but safely reopening our mental health facilities is vital to stop the spread of this addiction to opioids and other drugs that continue to plague our communities. But let's talk about what mayors need to safely reopen. There's things like we've talked about, PPE, testing, tracing. Every reopening plan should have those. But I think something that we need to talk about with less hyperbole and more nuance is how we talk about making these decisions. Mayor Curry, just a shout out here. As the state of Georgia began to reopen plans, the Washington Post declared, and you already alluded to this, that you lead the race to be, in the state of Georgia, they were leading the race to become America's #1 death destination. The Atlantic called Georgia an experiment in human sacrifice, which is so unfair, just irresponsible. And then all too often, we see articles ignoring critical nuances or burying these numbers. A headline can sound like an alarm and spike cases, and at the same time, some kind of rationale and explanation, like a decrease in the rate of positive tests or a decrease in hospitalization, never gets reported at all. And sometimes our eyes can be deceived. Just like in Jacksonville, when you open those beaches, and the headlines talked about, look at the overcrowding, look at the irresponsible people, and yet you would see a picture zoomed in on people, but if you saw an aerial view, they were still social distancing. It just depends on the kind of picture and the perspective that it showed. But you know what? We're so far past that of media calling people irresponsible when you're trying to do the right thing. I just want to use the time I have left to talk to Mayor Curry about when Jacksonville did reopen its beaches. The hashtag was Florida Morons, trended nationally. Needless to say, that coverage wasn't helpful. It wasn't charitable. Can you talk about how that affected your ability to manage your own city and communicate with your own citizens about reopening? And can you also talk about the role of this hyperbole and nuance in the reopening discussion?
Sure. Thank you, Representative. Appreciate the opportunity. We did the best. I did the best I could to ignore the national media when that was happening. I promised the citizens of my city that I would be transparent with them, share information with them as I had it, take advice from physicians and scientists, but recognizing that those of us that are elected have to make decisions with all of the input of those around us. It's on us to make those decisions. And some of that goes with experience. Essential businesses included grocery stores, other facilities that were open during the safer at home orders. Our daycare centers in the state of Florida never closed down. So my experience was, you had people in grocery stores, you had people in daycare centers for weeks, and we didn't have hot spots and outbreaks. So it made sense that outdoor activity on an open space in a beach would be a safe place to move. Go back to where our governor led on the front end, and he worked with President Trump. Assisting living facilities, respiratory issues, compromised immune system. That's where we need to focus. That's the people we need to protect.
Thank you, sir. Mr. Chairman, thank you. I yield back.
Thank you very much. I recognize Mr. Raskin.
Thank you very much, Mr. Chairman. I join the calls and prayers for justice and peace in Minnesota, where the Floyd family is still experiencing unspeakable grief in the wake of the killing of their loved one. Mr. Chairman, thank you for calling this important hearing today. This committee is the anti-swamp, where we take on every insider scheme to rip off the American people and steal the resources that we have invested as a country in economic and public health recovery. Our focus is on making the American government work for the people, and that means promoting the nationwide federal public health testing, contact tracing, and quarantine strategy that has been missing from the beginning of this crisis. Mr. Chairman, it's amazing to me that some people think that the Constitution grants a special religious exemption from general public health orders. The Constitution doesn't even provide special religious exemptions for any useful, universally applicable law. And for that proposition, I'm just going to read Justice Scalia's very learned opinion in Employment Division versus Smith. If there is a rule that anybody assembling in groups of employment 6 feet distancing, that would apply to a political party, even though it's operating. That would apply to for office, even though that's operating under the First Amendment. And it would apply also to a church, even though they're operating under the First Amendment. Now, last Friday, the Centers for Disease Control released guidance for faith communities advising places of worship to limit the use of choirs and tightly packed musical ensembles because the act of singing may contribute to transmission of COVID-19. The CDC also warned of super spreader events, whether secular or religious, where the virus is highly transmissible, including group singing events like the choir practice in the state of Washington, where one super spreader infected 52 other singers, including 2 who died within a few weeks. There was also an outbreak of 70 infections from a church in Washington, and an outbreak also in an Arkansas church that infected more than 1/3 of the assembled congregation and killed 3 people. The day after the CDC published their guidelines, the White House forced their removal and replaced them with altered guidance that removed all mention of the high risk of transmission in group singing events and deleted other scientific evidence-based advice. Now that's just dangerous. Mayor Garcetti, you've announced that houses of worship in LA may reopen as long as they follow neutral public health state guidelines. Can you describe what those guidelines are in California?
Absolutely, thank you, and thanks for that opening. This past weekend, I spoke at my synagogue virtually, gave commentary on the Torah portion for the first time in my life. My rabbi, Sharon Brous, invited me to be a part of this. We have a prayer circle every morning with my rabbis and a bunch of pastors and a few members of the faith community come together to get us through this. And we know how important faith has been. But we also know how dangerous it has been. Mayor Scott and so powerfully talked about what happened in the city. My heart aches for that sort of death. And I know that you've talked about it, a pastor came from Tulsa and traced back some of what might have happened there. We need to practice faith, we need to practice freedom, and we need to do it the way that doesn't kill us. And so right now, 25% of capacity is allowed in the state of California, or 100 people, whichever is less. We've had counseling, the ability to go in and talk to your pastor, the priest, your mom, rabbi throughout. Like, this is a way to make sure, but I've got to say, most folks are not going back to church, they're not going back to synagogue, they're not going back to their temples or mosques, because they understand that that's danger. It was a funerals, it was a choir practice, and these places were some super spreader events. So given that guidance, it's allowed. But I would say, we have this myth that once we open it up, everybody's back there. Like this impact on normal. So
I'm sorry for any insinuation in this town that you still have great Mayor Bobby says that we crossed between the church and 38 million have been thrown out of the work during this pandemic crisis. There has been a rather helter-skelter, chaotic response with lots of states going in different directions. Do you think it's important to have a coordinated national guidance to promote safe reopening? Do you see dangers in a continued scattershot, chaotic, helter-skelter approach?
Yes, I do, Congressman. And the concern that I have is that as we face potentially a second wave from this pandemic, we are now continuing to recover and learn what the playbook is from the first wave. This is not a city facing a tornado or a flood or even a drought. There is no playbook for this. That's why it's important that we have a coordinated effort on behalf of our federal government to give us a framework for how we can and should proceed as cities across this country. What we know about COVID-19 is that it knows no geographical line. It does not behoove any of us to close down our city. It was not my wish to not be able to attend my son's high school graduation. This is not where we want to be as mayors or as Americans, but certainly we need a framework and we need guidance from the federal government. We are learning as we go. We are creating a playbook as we go. And my concern that in the event of a second wave, we will not have memorialized and learned the lessons from the first wave, and we will be in a worse off position than we are today.
Thank you, Mayor Bottoms. And Mr. Chairman, I just want to salute all of these local heroes as well as mayors in my district, Lakesville, the Middletown, the Rockville, the Kensington, Tacoma Park, for what they're doing to support the people on the front lines. I yield back.
Thank you very much, Mr. Ratzman. Thank you, Ms. Bottoms. We now recognize Dr. Green.
Thank you, Chairman Clyburn and Ranking Member Scalise, and thanks to our witnesses today. I too want to send Tennessee and my family's prayers to the people of Minneapolis and the Floyd family. At our last hearing, I spoke about how changes in the science of medicine often lead to a complete reversal in what we do. I gave the example of treating pain with opiates and creating addiction. Since that testimony just a week ago, the New England Journal of Medicine has published an article that says wearing a mask outside the hospital setting offers little, if any, protection from infection. Let me quote that in context. Quote, "We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID as face-to-face contact within 6 feet with a patient with symptomatic COVID that is sustained for at least a few minutes, maybe 10 minutes, maybe 30 minutes. The chance of catching COVID from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic," end quote. Again, that's the New England Journal of Medicine this week. Before I'm misquoted, I want to assure you I'm not taking a position on the mask issue. I just want to point out that as more research continues to be done on the coronavirus, the novel coronavirus, we have to be cautious to not make broad sweeping changes to public policy with ever-changing medical information. That's my contribution to this committee. And we must be cautious to criticize our leaders for decisions and statements made in real time based off the best available data at the time, like criticizing the president for statements in February based on medical information that we have today. That includes his comments about China. As a doctor, I can tell you the cost of waiting to reopen until a possible vaccine is going to cost lives, and that is well-established data. Consider the additional 33,000 cancer deaths that are going to happen due to delayed diagnosis just because the hospitals are closed. We've got to consider deaths from suicides that are expected to exceed 75,000 additional patients, or the thousands of heart attacks and strokes due to deaths because people are afraid to go to the ER. There seems to be a difference between how some states and cities are responding to the decision of opening up. It's clear we've flattened the curve. Not a single American has died because we didn't have a ventilator or because we didn't have an ICU bed. But some want to keep Americans at home until there's not a single new transmission of the virus. That decision to delay reopening will mean more deaths to cancer, heart attack, stroke, and suicide than if we opened up today. As a former state senator, I understand the federal government has a role. The president has a sensible plan with guidelines. It's just not the top-down, centralized approach that concentrates power in the hands of a few and that treads on the state sovereignty. It's a resource-based guideline approach that lets states make their own decisions and then live with the consequences, something our founders would be proud of. Further, this public health emergency should not be used as an excuse to bail out past reckless state and local government. Tennessee ranks in the top 10 states of the least state and local debt per capita. However, Illinois, California, and Washington ranked in the top 10 for the most state and local debt per capita. Illinois hadn't balanced its budget since 2001. Tennessee, on the other hand, has been on sound financial footing for decades. Why should Tennesseans be forced to bail out Illinois' reckless spending? For instance, $23.6 million on programs that encourage people to ride their bikes, or $13.1 million on an arts council chaired by the wife of the Illinois House Speaker, Mike Madigan, or research on monarch butterflies, or programs to encourage young people to take up golf. I mean, why not fishing? I'm a fisherman. I guess it's just more government picking the winners and losers, and this time in recreation. Why should Tennessee be forced to bail out the city of Philadelphia, which made at least $924 million in bookkeeping errors in 2017 alone? If I bounce a check, it's not your job to pay my debt, and it's unfair and frankly immoral to ask you to do so. We need to reopen the economy and get Americans working again. This will help restore not only the budgets of our citizens, but the budgets of our state and local governments too. And as I started this conversation, it will save American lives. Mayor Curry, a quick question. What are the consequences for healthcare in your city if we don't open up soon?
The consequences are dire on so, but Representative, thanks for the question. The consequences are dire on so many fronts. As I said before, 100,000 deaths in the country. People died alone. Tragic, terrible that this virus came here. We didn't have the facts from the World Health Organization and from China. But we've got to reopen this economy and focus on the vulnerable. Just to echo some of the things that you said, I agree that a top-down approach doesn't work. Every city, every municipality is different. I agree that we shouldn't be bailing. COVID-19 relief should not be used to bail out poor decision-making. In my city, we built up significant reserves of the last 4 years in the event we face a crisis. We reformed our pensions here in Duval County, secured a source of revenue, put new employees into defined contribution plans versus defined benefit plans. So relief from COVID-19 is needed, but it needs to be specific to the pandemic, not bailing out poor fiscal decisions.
If I could just state what I heard you say to our committee, you didn't spend money on monarch butterflies or encouraging kids to play golf. You put it in the bank for a crisis. Thanks.
Thank you, Dr. Green. The chair now recognizes Mr. Kemp.
Thank you, Mr. Chair, for convening this. I wanted to start with a couple of questions to Mayor Garcetti and Mayor Barnett. Mayor Garcetti, at the end of your opening comments, you started to talk about the deadline that's coming up, as well as what would happen after that should you not be able to receive funding, or other states or cities not be able to receive that. I'd like to drill into that and just really try to get a sense of the urgency here and the timeline of your decision making. Tell us what happens at the end of next month. Tell us what happens if you don't get that funding, and what would happen to the city workers and the local workers there, and the other decisions that are on it.
Absolutely. And again, I think we see this in such a nonpartisan and bipartisan way. I mean, you've got as many Republicans in Southern California as I think in many of the states that are so-called red states. We've got 10 million Republicans that are in California. Many of them work in city government. In the same way that PPP didn't just say, here's money, by the way, whether you ran your business well or not, and I'll get to that in a second. PPP didn't say, hey, here's money just for your expenses with COVID-19. It was, here's money to keep people employed. I think we really have to keep focused on that, because there will be layoffs, there will be shortfalls, and from very well-run cities like mine that also, congratulations, Mayor Kirk, great job in Jacksonville. We've done the same thing and had double our reserves before 2008 when this crisis hit, and Wall Street, don't take my word for it, hasn't even downgraded us in the midst of this. But you've got places like Ohio where income tax is much more important. I've talked to mayors who are looking at laying off 20%, Phoenix and Arizona, where they've already started looking at the layoffs. This will come in the next couple months, and I guarantee it'll be the biggest bump in the unemployment numbers as we reopen. It'll more than wash over the progress that we do. So it is to keep employment and to deliver those key services we need to win this fight.
Thank you, Mayor. Mayor Barnett, I wanted to turn to you. My district looks a lot closer to the size of your town than it is to Mayor Garcetti. So I want to get a sense of are you seeing that same thing? Are you having those same types of deadlines, that urgency? What would happen if you were not able to get these resources at the time that you need?
Thank you, Congressman, for the question. Yeah, the size of the city doesn't seem to come into play too often. The critical nature of this is still the same. I'm from a red city in a state that voted for the president. Our city has traditionally been very financially sound, but without any mismanagement, we're going to lose a third of our budget. And there are not too many places across America, Republican run or Democratically run, that could handle that without massive cuts. I've got parks employees on furloughs. I've got building department employees on furloughs. We've laid off folks. Those are real things that have impacted the service, because in local government, you can either raise taxes, cut services, or innovate. Well, it's impossible to raise taxes right now. Cutting services is what we're forced to do, and of course, we're thriving on a spirit of innovation, as most mayors are, to try to find new ways to do things better, a little more efficiently. The cuts are real, and it's not just in cities like mine or maybe like yours in your district. Every community in America. A study we did, the National League of Cities, looked at 2,400 communities across the country. 2,400, 98% of them. That is irrespective of party, geographic location, financial position. 98% of them said they're going to have massive budget shortfalls. So, Congressman, you're tuned into the fact that the time is now, and the message is critical.
That's great. Yeah, I agree with you wholeheartedly here. I think it's that timing, that urgency that I really want to get across to my colleagues in Congress and to other leadership, because we spend a lot of time talking about what you need, but it's also about when you need it. And when I look at this in my own district, we see what happened with the coronavirus. It's no fault of your own. All of you mayors have been trying to respond to this. In my district, we experienced something similar a couple of years back, where it's no fault of our own due to Superstorm Sandy. We had a tremendous amount of problems that we had to recover from. Ranking Member Scalise, also from a state that understands what it's like to get hit by a natural disaster, no fault of your own. And this isn't about budgeting and whether or not things are seen in the right way. Whether or not these are right decisions. We are facing a disaster here that we're trying to recover from. My district is still trying to recover from that. And Mr. Barnett, I wanted to seek your thoughts, since you engage with mayors all across the country. My towns and my district are continuing to struggle, having to pay off debts to the federal government from the Superstorm Sandy, and they're having to continue to do this through this crisis. Do you think that the federal government should be considering easing or canceling some of these debts to help these towns get through this current crisis?
Well, again, it's a complicated question. I know for a fact that cities can't do this without federal partners. We're just not set up that way. And so that's why you see mayors from across the country on this panel pleading with you, all from different political backgrounds, but all really professing a love for their communities and a desire to see them succeed. We want to see them reopen. We want to see our business community reopen. I have a lot of ideas and suggestions about that. But we have to have the federal partnership. And as to date, it sounds like most of the cities in your district, probably none of them have received any federal support. Unless you're over 500,000 population, you haven't received federal support directly yet. So the idea that we have to work at this together, which is why, coming from the Conference of Mayors, the idea that we have to approach this from a nonpartisan perspective, that all of us are Americans and desire to see our communities succeed, our small businesses succeed, and our communities stay healthy is critically important. We're willing to put any idea on the table. I think, there's some general concern, in Heroes, that the Heroes bill is too big. From a Republican side, and the Democratic side of mayors may be concerned that the Republicans may put too many restrictions on it. Most mayors I talk to are absolutely willing to talk about some realistic guardrails in order to get the federal support we need. We really feel like we can be partners because we understand the need on the ground in the moment. And that's what we're here to try to express to you.
Thank you very much, Mr. Kim, and thank you, Mr. Barnett. Before I close this briefing, I would like to yield now to Ranking Member Scalise for whatever closing statement he might make.
Thanks again, Mr. Chairman. And I really appreciate all the information that was shared here today and what input the mayors have given. Clearly, I think we all want to see our communities get back open, understanding safety, understanding the reality of the negative consequences. What we saw as communities got shut in through no fault of their own, but obviously the opening is going differently in different communities, and hopefully we will keep sharing the best practices. And I know each mayor has brought some different things to the table that show what can be done well, but I think we all ought to be looking at those things that have been successful so that communities can safely reopen. It's disappointing when you see media hysteria saying one thing, and then you'll see a town like Jacksonville reopen, and the beaches, even though it's social distancing, they'll try to portray it as something other than what it is, and try to act like there's going to be this mass outbreak of deaths. ABC News just did a study, I think it just came out today, where they looked at 21 different states that aggressively reopened. I think they looked at
are those states that reopen March 4th or sooner. And I think initially the reports were that those communities would see big outbreaks, and they noticed that none of those states had a higher than expected increase in COVID. In fact, most have flattened. And so that study was really important to show that there is a way to safely reopen, and we have to get our economies back up and running. There is no substitute for getting businesses back up. I've heard from so many small businesses that appreciate the bipartisan work we just did yesterday on reforming the Paycheck Protection Program, giving more runway to our small businesses. That was a case where Chip Roy, our Republican member who worked very hard with Dean Phillips, came together, came up with an idea, worked with businesses, worked with the Department of Treasury, and came up with something that we as Republicans, working with the Democrat majority, were able to pass with over 400 votes, a massive showing that hopefully the Senate will take and move, and then get to the president who wants to sign that bill. So it shows you we can work together and have found ways to innovate and address some of these problems, and we need to keep doing that while we help get businesses reopened, because there are some businesses that even without all this really trillions of dollars we've already passed still won't be able to reopen, and those jobs will be lost. Let's try to limit that. We limit the loss of life. We also limit the loss of jobs, and we limit the loss of life that's tied to the closing down of the economy. So, Mr. Chairman, again, I appreciate you giving us this forum. Hopefully, let's continue to share these best ideas and keep helping to safely reopen this country. Now you're back.
I thank the ranking member for his friendship. Thank him so much for participating here today. I thank all members for their participation. And I want to thank the panelists for their remarks. We know how busy you are. You are on the front lines, leading your communities to a historic crisis. I think I speak for all of our members in saying that we are grateful for your leadership, your insight, and your tireless work on behalf of the people of your cities and this nation. And what came through loud and clear in today's panel is that America's communities urgently need the federal government to exercise leadership in order to beat this virus. Well, COVID-19 has precipitated the closing of businesses, the suspension of educational pursuits, the reduction of folks, the deferral of dreams. Several of our panelists and
this has been remarkably peaceful.
With comments today, offering prayer and condolence to George Floyd and the city of Minneapolis. As I listen to these comments and as I focused this morning and last night on what was occurring in Minneapolis, Minnesota, and listening to the comments of the day, I reflected upon this panel's work. And I found myself a bit ridiculous of expressing how I really felt. And then I thought about a poem that gave rise to a play in which I participated as a college student. And asked the question, what happens to dreams deferred? What happens to a dream deferred? Nancy Lee looked those words, looking at the hollow, the city of New York, with certain challenges like these were being experienced. And he wrote these words. What happens to a dream deferred? Does it dry up like a raisin in the sun? Or fester like a syrup and then run? A steak like broccoli meat or crust and sugar over like a syrup is sweet. Maybe it just sags like a heavy load. Or does it explode? Let's read from this
over there, maybe Miguel can get a shot at this. The other side of the building, there's a fire there as well. Then there's a fire there at the liquor store down there, and there's another fire behind us over there. So we have several fires going on. We still have no meaningful police presence here. We do know that there are 5 or 6 police officers in there. They've been the ones with the flashbangs. You can still hear them from time to time. I've not seen tear gas in the last little while, but there are real efforts to get into that police station over there. And we now do appear to have fires on both sides of it right now. We're also hearing some reports about other fires going on in the city. So this is, and I see helicopters above us, so there might be a better shot of this than I've got. But right now, the protesters are very, very focused on this police station. We're hearing a lot of noise. It's obviously gone dark. So other than the flames, we can't see as much. But there are efforts to get into that building. And again, we do not know what the status is of the police officers who are in there. The relevance of this building is that this is where the 4 police officers who were fired in connection with the death of George Floyd were based. So this, a few years ago, there were protests at the 4th precinct. There were encampments outside of there. Now it's the 3rd precinct. This is now where all of the attention is tonight. Brian? Large parking lot. It's right on the corner. So the crowd was in the thousands at various times. Very hard to tell at this point, but you do make a very important point. The crowd's diverse. And I've had a lot of people come up to me, and they've got real complaints about systemic prejudice. Some of it is about specifically what's happened. Some of it is protesting the police, but a lot of it is systemic stuff that they're saying, look, Minnesota's experienced a lot of it. Americans experiencing a lot of it. We've got videos. We now have videos from 3 angles. What's the Hennepin County attorney worrying about? What are they doing? And there's just a lot of anger out there tonight. Obviously, this will be the center of it because this was something that was geared around 4 police officers and George Floyd. So this is the center of it. But the conversation here is diverse, and it is about social justice issues broadly and remembering George Floyd. Every few minutes, you'll hear Black Lives Matter, you'll hear say his name, and you'll hear protest. But this is a protest. It's not something else. There's a protest because people are very angry about what they've seen this week, not just here, but across America, Brian. Yeah.
Okay, so the real deal behind, what we're going through right now. Understand that, when I'm sharing a video, when it's being streamed, there are less than a few people, not very many people in the room. And if you're not paying attention, then you don't know what's going on, and that's so true. We all must have a personal responsibility to understand that we have a responsibility, basically, to participate in the public oversight process of public services that we all pay for. And so how do we ensure that it's happening? Well, you have to follow. You put people in office that actually represent your interests, and then you stay in contact with them to ensure, and you pay attention to where you live, local communities. The problem is that we've elected people to represent us, and they're representing themselves. And then they appoint people to represent you in your community, and those people don't even participate, so you don't even know what's going on. So here we are in a nation where all represent, a dollar value. Because as long as you're here, you're paying taxes and you're providing in the system. You're paying for water, you're paying for lights, gas, electricity. I mean, we're helping America survive. But when we're looking at the outcomes and the failures in the system, we have to demand accountability. So this must mean that we just have to regroup, reanalyze where we are and where we've been. Because, you know, this and all these things that are going on with me really have to do with my living and making a living and ensuring that, and this too, you know, that we are successful in life and that the remedies provided actually work for us. And right now, I can say the remedies provided don't work and they're not working and the system is broke. So this is another look at a day in the life of me, and I'm sharing. And so I'm going to end the video for now and upload the video.